Okay, so the idea now is to talk a little bit about the anatomy of the proximal femur. Not all the femur, just the proximal area, because it's part of hip fracture talking. So when we look at the femur, we have the region of the proximal femur, which is right over here. And this area articulates with the acetabulum, the pelvic bone, and this is a very important area for fractures, hip fractures. And when I'm talking about the hip, I'm talking about the area around the hip joint, which is the articulation between the femoral head and the acetabulum. So when we are looking on the hip joint, what we see is this is the proximal femur. And now we have important areas. And we have the greater trochanter, lesser trochanter, intertrochanteric crest, femoral neck, and a femoral head. Now, it's important to see that most the femoral head and most of the femoral neck are part of the capsule, are in the capsule, namely they are intracapsular areas. And this area, which is the area of the base of the neck, also called basicervical region of the neck of the femur, is extracapsular. It's important for fractures because fractures of the neck that is intracapsular and fracture of the head of the femur both are really sensitive to avascular necrosis because they can disrupt more easily the blood supply to the femoral head and neck or the femoral head and cause avascular necrosis. So if we are looking on the blood supply of the femoral head, what we can see that if I'm making it a little bit bigger, I can see that the blood supply comes from this deep femoral artery known as the profunda femoris artery. Now, this gives rise to the most important artery to the femoral head and neck, which is the medial circumflex femoral artery. There is also the lateral circumflex femoral artery. Those give branches to the femoral head and neck. Now, if you have intracapsular fracture, namely femoral head or femoral neck, without the basicervical region, because this is the region which is extracapsular, you have increased risk of AVN, as we said, because you can disrupt the blood supply. So everything in the capsule of the femoral, uh, of the proximal femur, let's call it, is in risk for this avascular necrosis. So if I'm looking for a an image with the capsule of the femur, everything is inside of the head and neck except for the basical cervical region. Maybe we'll see another better image of this. Maybe this one is also good, mostly inside except for the basic cervical region. Now, the idea of talking about this proximal femoral anatomy is to talk mainly about the fractures eventually. Now, there are many classifications for regions for proximal femur fracture, but because there are many, so everyone says different things. So we need to talk about simplified classification for proximal femur fracture, and this is what we will probably do. So this is it. This was about the anatomy, basic anatomy of the proximal femur, including the capsule, the head, neck, basicervical region, greater trochanter, lesser trochanter, intertrochanteric crest, and maybe I should also mention the subtrochanteric region, which is right over here. So if we go again, and we will look in better image. So we had the femoral head, neck, basicervical region, head and neck without the basicervical region are intracapsular, basicervical region extracapsular, important for areas for fracture that can cause avascular necrosis by disruption of blood supply, intracapsular risk for IVN, extracapsular less risk if you treat it appropriately, greater trochanter, lesser trochanter, intertrochanteric crest or intertrochanteric region if you want, and subtrochanteric region, which is right over here. Okay, now I didn't talk about all of the anatomy. Let's just maybe go throughout it. Here is the lab room. We also already talked about it. We have here the ligamentum teres comes from the transverse ligament and goes to the femur. This is area without articular cartilage, without labrum. And this is the capsule, important because intracapsular, high risk for avascular necrosis. And this is it about the basic anatomy of the proximal femur, including blood supply, which is very important to remember. Thank you very much. If there are any mistakes or correction, please tell me. And that's it.